Hello everybody, this is Kate Wellensick, and I'm going to be presenting a PowerPoint on South Dakota Steps to Wellness Program. Steps to Wellness Program. Why did I choose this topic? I had a very difficult time choosing the topic for my project this semester. So where do you go for answers? Google. So I Googled wellness programs in South Dakota. Nothing really stuck out to me at first until I saw the Steps to Wellness program. I know it doesn't necessarily fit in with our instructions, but I found a way to make it fit. So the reason that I chose it was because I feel that if we as clinicians are not living a healthy lifestyle, how can we expect our clients to? We should be role models for our clients and avoid saying, do as I say and not as I do. Again, we should be role models. So how did this program come about? So the South Dakota Department of Health received a grant called the Steps to Wellness Workplace Physical Activity. This was primarily focused toward professionals or professions where individuals spend a lot of time sitting. Their initial focus was truck drivers and law enforcement. But just think, we spend at least 40 hours a week at work. How much of that are you sitting down? So what is the purpose of this program? Basically, help employees live a healthier lifestyle at work. Because if you're healthier at work, hopefully you'll be healthier in your personal life at home. Inactivity is a major health risk. So again, why is this program important? Due to health issues that result from the lack of movement the employees have while working, it can cost employers a ton of money. Think about your doctor's appointments, when you're calling out sick, all that kind of stuff. Some of the health issues that can come about from lack of movement is an early death, heart disease, stroke, type 2 diabetes, depression, and some cancers. The Center for Disease Control and Prevention, the CDC, has been in support of this program also. In 2014, South Dakota had 30% obesity rate among its residents and 35% were overweight. So how do you get involved? The South Dakota Department of Health advertised across the state to have different employers apply to receive money from the grant. 20 places were chosen in the beginning. Each year they've been aiming to get 10 new employers involved to receive money from the grant. As a recipient, you receive $2,000. So again, they advertised in newspapers. I know that Argus Leader had an old posting that they did back in 2014. They also listed on the South Dakota Department of Health's website an application for it. So who was selected? There's a variety of different employers on this list. Hopefully you can see them. Again, the reason that I kind of chose this was because I have been somewhat directly impacted from this. The Pennington County Sheriff's Office is where I work. I work in one of their divisions, the City County Alcohol and Drug Programs. And again, remember that initially it was focused towards the people like law enforcement and truck drivers who spend a lot of time sitting, but then they've started to broaden some of their main focus because they wanted to reach more people in South Dakota. So what happens after you're selected? The state provided 2 key resources with the selected employers. The CDC's Steps to Wellness, a guide to implementing the physical activity guidelines for Americans in the workplace toolkit, which is a pretty good outline of how to get people involved. And then the South Dakota's model worksite physical activity policy. So between those trainings and resources, the employers have been able to make big changes at their work sites. and they've been able to implement these programs and hopefully reach, most of their employees. So most of all, changes. That is what happens when you are selected. So Pennington County Sheriff's Office, what changed? And again, this is where I work at City County Alcohol and Drug Programs. Over the last couple of years, we have seen some changes at all of the work sites to help each area improve. We have healthy snacks that are available on site for you to purchase. We bought a mini fridge that, we keep healthy drinks in there that you can also purchase. Two of the biggest things is we have an elliptical and a stationary bike at all of the branches of the Pennington County Sheriff's Office, which, they encourage you, and, we've got 15-minute break, go ride the bike. If you got your lunch break and you don't want to leave, go on the elliptical for a little bit. All of these things have really helped improve the activity level at City County. I know at other branches of the Sheriff's Office, they've worked on improving the gym that we have at the jail in the public safety building, which is right by the jail, but that's open to all employees. They've worked on improving that and getting a few new machines in there. So also, part of this program is trying to find ways to get all of your employees engaged. So not only have we made things more accessible to us, but they have also made it fun. Maintain Don't Gain is a challenge to maintain your weight over the holidays. It changes slightly over each year, but it looks over many areas of your life. They make it kind of a weekly challenge, but you accumulate points each week, and then at the end, depending on how you did, you have an overall score, and then they announce the winner. They check your weight each week. They don't make you feel bad about it either if you happen to not maintain and you accidentally gained. They don't make you feel bad. They still encourage you to keep improving because, remember, muscle is heavier than fat. They also look at your food and drink intake, your sleep, and your physical activity. So how much time are you working out each day? How much water are you drinking? What kind of vegetables are you eating? But I have really enjoyed the Maintain Don't Gain challenge because it does look at so many areas of your life. And not to brag, but I did win the first year. The next one is the Frozen Lake Winter Rowing Challenge. This allows people to see who is the most fit. It's great for those competitive people. Again, the rowing machine is just down in the weight room in the public safety building, so nobody's having to go out on a frozen lake, thankfully. I don't think we'd have as good of a turnout then, but I know they've been getting quite a few people involved each year. Again, really good for the competitive people. You don't have to sit down each week. It's basically on your own time, and then you just submit it. So that's another great activity that they've been doing. Hiking is another one. For us, we live in the Black Hills, so it's a great area to go hiking. It's just a great way to get out of the workplace and spend some time in nature while with coworkers. So of course we take all safety precautions with this, pick easier trails to go on, and we kind of have a checklist of how many people are going out with us and make sure everyone makes it home that day. So some results here. Improvements were made at many different facilities across South Dakota. They really encourage that you have bike racks to encourage employees to bike to work if they can. Many employers have made sure that their stairwells are well lit so people can use the stairs instead of using the elevator. Walking areas. A lot of the employers have set walking areas in and outside of their workplace and actually given them time to go do that. Some employers have been able to give their employees flexible schedules in order to go work out, or they also get paid time to go work out. The surveys were really interesting because in the beginning, from the self-reported survey, people were reporting around 85 minutes per week of physical activity. By the end, about a year later when they did the post-survey, they were about at 104 minutes of physical activity a week. And then we have this great quote that is up here that was from one of the surveys. Once my employer gave me time during the workday to exercise in a gym I could readily access. It made a huge difference in my total exercise each day. I think that just goes to show you when an employer emphasizes something as important as your physical health and they encourage you to go and do it, that's going to get your employees being more active and hopefully keeping them healthier, because that's the overall goal, is we want to avoid some of those health issues that we discussed earlier with the earlier death, the cancers, the stroke, all of that kind of stuff. We want to avoid that. So what happens next? The Department of Health is continuing to add more employers to their list. They are also collaborating with the health management partners, an insurance company, to reach more employers. I've actually seen a few things where they've said that if an employee is taking part in one of these programs, that then they could get cheaper insurance rates. So the more that we emphasize this, the more that it's just going to impact more people, and they're going to see that, and more people are going to want to get involved. Also through this program, the Department of Health want to have trainers to enhance the physical activity efforts. So they mean trainers in implementing these programs. They can go across the state and help implement the programs, and if something is going wrong, they're there to correct them also. Again, I'm a big advocate for this just because I have seen what it can do in a workplace. I am one of the younger employees at city, county alcohol and drug programs, but through the Steps to Wellness program, I've been able to see a lot of my older coworkers getting physically active and taking better care of themselves. I've heard clients comment on how they appreciate that, we're not preaching to them anymore, and we are actually doing what we ask them to do. But anyways, thank you for your time, and I hope you have a great day. Thank you.